Once again, thank you all for joining in again for another session. Today, we'll be hearing a very different topic about how to organize palliative care services, because we have been hearing during our discussions that we have to mobilize volunteers, we have to do this, we have to provide this kind of services. So, but we have not discussed how to organize these services. So I would like to welcome Binod for taking this session. Binod is basically from an IT background, but have seen palliative care in the very early time since it started in Kerala with Dr. Rajgopal. So he knows in and out of how it works, and he's been a trustee for many years with Pallium India and work with many things happening in Pallium India at his volunteering level. So he'll be the best person to handle this topic. Welcome, Vinod. Nice to see you again after a long time.
Thank you, Sridevi. Thanks a lot. And shall I share my screen, Raju? Is it okay?
It is okay, sir. You can share it.
Just hold on. Is it visible?
Yes, sir.
Yes.
Yes. It's nice to be back. I think there was a break in between for this ECHO course. How long has it been, Raju? I mean,
Actually, sir, we stopped for 1 month in between, and then we rejoined the classes again.
Okay.
Binod, sorry to interrupt. Before starting, I wanted to give you a background of the participants also. These are all non-doctors who work for under several institutions under CHAI, Catholic Health Association of India.
Okay.
Yeah, so they are all doctors working in various parts of India. Most of them are in rural places. So most of them belong to CHAI, although we have a few doctors working in other sector also, other hospital also.
Wonderful. Thanks for that. That was very helpful, Sridevi. So one small correction to what Raju mentioned earlier, and I think it was corrected by Sridevi. I am not a doctor. I am actually an engineer. I'm trained as an engineer, but mostly on right now. I'm into managing my own companies and been involved with palliative care since its early days. I'm now a trustee of Palliative India. So that's a brief background. Anyway, thank you for the introductions, and I think we'll jump right in. And I think this is special because this is from one specific set of organizations, which is CHAI, if I understand correctly. It is a Catholic Health Association of India, right? CHAI stands for that, I believe. Yeah. So we are not going to dwell deep into the palliative care services as such, in the sense, the technology side of it, which I am sure you all must have been exposed to by now. There have been experts who have taken classes and given classes on communication skills and how to do an intervention, pain management, and all those things. Now, there's something different from that, in the sense, we're trying to focus more on how do we go about setting up a palliative care service. Now, why this has been included into the curriculum is because most often what we find that people like you who are into healthcare, you are either working with institutions or practicing independently, where you are in a particular setting where you have certain things taken for granted. Like, for example, if you are in a hospital, you know for a fact that there is going to be an operating theater. You have basic medicines. There is a pharmacy out there. You have nurses around you. You have social workers or Sometimes it could be physiotherapist or whoever it is. Now those things are already there, and you are supposed to take care of just the patients, their problems, work towards finding solutions for that with the patient or the family. Now here we talk about adding more. Sorry, am I still audible? It says the internet connection is unstable.
Yes, sir, we can hear you.
Yeah, okay. Sorry about that. So now what happens here is we are adding more what you call normally more things that are normally not considered under healthcare, like for example the psychological, social and spiritual aspects. Now when we add that into healthcare, we often end up in a situation where the healthcare provider is at a loss. How do I provide this? My current setting, the hospital or the clinic or whatever, we don't have people to take care of that. One, or it could be, for example, specific medication like morphine. Now, I don't have access to morphine. Our pharmacy does not stock morphine. Now, these are situations where you need to go beyond what is currently available in your healthcare facility if you want to really provide the service to the patient or the family. Now, therein lies the challenge. That means accessing more resources than what is currently available, and how do we access it? That is the relevance of this particular session. We are going to delve a bit more into the organizing part of palliative care. How do we ensure that the kind of the services that a patient or the family requires, how can it be offered to them in the setting, working within the setting that you are in currently? Whether it is, in your case, probably it is a hospital, which is under the Catholic management, whatever it is. Now, there you have a particular set of facilities, resources, and within that, how do we provide this additional care?
Binod, sir?
We may not be able to delve deeply into these topics because it will take a lot more time. I am given around an hour and 10 minutes. So feel free to interrupt in case you need you have any additional queries. We'll stop and then address those also. Now, the topics that I would like to cover in this session would be more around volunteering, collaborating, advocacy, and fundraising. Now, let's just have a look at the definition of palliative care. Now, this is something which you are all familiar with by now. It's nothing new to you. So, essentially, we are talking about an assessment and treatment of pain and other problems, physical, psychological, and spiritual, all these things, psychosocial and spiritual. Now, who is supposed to take care of this? Whose business is it? Now, any responses? Anyone would like to? Who is primarily responsible for providing this? When I say providing this, I meant the psychological, social, spiritual care which is supposed to be provided, and of course the physical. Yeah. So yeah, team-based. Yeah, very interesting. Thank you. Punit, is it? Yeah. Family included. Fantastic. Yeah. Anyone else? The one who meets the patient often. Yes. Yes, very much. So if I say that palliative care is everyone's business, that is, everyone, including you and me, are involved in this, and we need to step in. Each of us have a role to play. Now, would that be something which everyone would agree upon? Because typically, what happens is, why I want to highlight this is because whenever we talk about healthcare, automatically the feeling is, okay, now health is something which is to be dealt with by the healthcare professionals. Now, who are these healthcare professionals? Doctors, nurses, paramedics, psychologists. Some may even not consider psychologists. But when I say everyone, that includes me, who is not a trained medical professional, because I don't have a degree in medicine, in social work, or anything to do with health. But then I consider palliative care as something where I also need to contribute, I need to be involved. Now, unless the healthcare system accepts this, I don't have a role to play. And thank you for letting me in. So when you say team-based, family included, anyone who meets the patient often, I belong to that community. I belong to that group because and for that matter, anyone in this world would obviously have met or been with the patient at some point of time or the other. So every single person has a role to play in palliative care, and it is everyone's business. So I think these are things which you have already gone through in your other sessions. So that the concept of total pain is not something new for you. We consider it as the total pain, which includes physical, psychological, social, and spiritual pain. And it's all individual, it depends on that person, the patient's circumstances, his family, and all these things. And like it was mentioned earlier, it's about the teamwork that is required and an interdisciplinary approach, that is what they say, right? And of course, a plan that meets the goals of the patient and the family and their needs. Now, who are the team members? Here again, I would like you to step in and help me out with this. Who are the members of this specific team that we are referring to? Who can provide this palliative care? So we just now mentioned that, it's a team effort. The team has to step in. Who are the team members? Anyone? So there are no right and wrong answers. Is it something that am I not able to see something, or?
No, there are no chat that has come in.
Okay, so I'll wait.
Yeah, it is coming up now.
Yes, thank you. Okay, physician, a nurse, MSW, counselor, therapist, doctor, nurse, family, social worker, paramedics, counselor. Very interesting. Thank you. Anyone else? Okay. So we'll move forward. Yes, of course, nothing happens in healthcare without a doctor, as we understand it today. Nurses, pharmacists. Yes, someone has said patient. Yes, you're right. Social workers, therapists, which include music therapists, counselors, bereavement counselors included, occupational therapists, physiotherapists, volunteers, and caregivers. Now, of course, the patient is also part of the team, and that is what we are taught to do in palliative care, right? So again, we go back to what we mentioned just now. It's everyone's business, and the team includes all of these. And the volunteer, I represent that community, the volunteer community. I am also involved, and thank you for letting me in, because otherwise I would have no voice here, and I would have no reason to talk to a group like this. Volunteers to help economically backward. I believe that was what Sister Lucy. Is it Sister Lucy or Dr. Lucy?
Sir, it's Dr. Sister Lucy.
Okay. Yeah. Okay. So Dr. Lucy feels volunteers to help the economically backward. Is that right? You can switch on the microphone if you want to explain a bit more. Dr. Lucy, would you like to?
Yes, yes. Economic help.
So you feel that volunteers can or should only be involved in the economical or rather financial help where it is required. That is the only thing that they should be doing. Is that right? Hello.
Yeah, that is one of the help.
Okay, so that is one of the areas. Okay. Other than that, do you think there are other areas where they can contribute? Okay.
In transporting the patient if they want to commute to the hospital,
Yes, absolutely.
and if they don't have children or destitute patients ke liye, they can just go and meet them and talk with them often. Those
Okay.
who spend time or money or even they are giving a company to the patient, anyone can be a volunteer in any of the aspect.
Absolutely. Thank you, Maheshwari. That was brilliant. Now I have one more question then. What if it's a doctor who is a volunteer? Can a doctor be a volunteer?
Yes, sir. Obviously. Yes.
So do you expect something more out of him or her?
Yeah. If a doctor is placed in an institution, out of that, he can go to maybe with an NGO or without getting fees. So I can say, like, even in the weekends or a neighbors or any one of them, and so that kind of help can be a voluntary help.
Yes. So now there's something interesting. The moment I say volunteers, immediately the image that comes to the mind is that of someone on the street who may not necessarily be trained in healthcare. He or she contributing whatever he can. So first thing that comes to mind is financial help. That is there. I'm not saying it is not there. Transporting patients, yes, very important. Yes, if you go beyond that, there is no limit to it. How and where they can contribute. It all depends on what they have to contribute. It could be in terms of time, it could be in terms of money, it could be in terms of whatever resource that we need. So let us not undermine the potential of the volunteers. We'll come to that. We'll discuss more about it later. So yes, technological help uninterrupted to keep services uninterrupted. Yes, and much, much more. So anyone who can contribute to improving the quality of the patient and the families, I would say, is part of the team. And all of us should be willing to work with such people who can contribute and are willing to contribute. It need not be just financial, any which way they would like to. Now, this is a typical healthcare setting at the macro level where we talk about the hospitals or the medical institutions, if we put it in the broader perspective, plus it may also involve the government, the private sector, all these things at the macro level. And of course, at the micro level, what is at the micro level? What does it look like at the micro level? How does healthcare look like at the micro level? Or for someone like me, where do I access healthcare at a micro level?
Is it at home?
Absolutely.
Home-based?
Absolutely. If I am falling ill, if I am sick, if I have fever, the first person to attend to me is probably my wife and my children and probably my parents. Now that is where I get healthcare. That is the primary healthcare that I get. A small viral flu. Of course, I'm not talking about COVID, but even in that case, sometimes it might be addressed at home. So let us also consider that as part of the healthcare delivery system. It's not just the hospitals and the big institutions that we are talking about here. But then, apart from these two, there is something in the middle. We call it the meso level. Now, this makes it very interesting. The healthcare system goes beyond the family and the medical institution into the community. We call it the social capital. Now, why do we call it the social capital? Okay, now capital in layman's term means it's the initial set of resources that is required to help build out something, offer service, or whatever it is. Now, you need capital to build an industry, to set up a hospital, whatever it is. So what does this capital look like? Of course, one component is again money. You need money to build a hospital, obviously, yes. But is that the only thing that is required? I would say no. Now, and if you look at it more closely, most often it is not the money that is required. Money is just a means to an end. Even if it is a hospital, why do we need the money? We need the money to probably buy land, then put up the structure, the building, then to buy the equipment so that you can have the diagnostic facilities, set up the lab, and so it goes. There's going to be a long list. And yes, for getting all these things done, to make sure that these things are set up properly, you need capital. And immediately what comes to your mind is money. And the money will solve this problem. But my question is, what if someone is willing to offer the land for free? Do you need the money for the land? No. What if someone is willing to provide you with a building? Someone comes forward and says, okay, I have this building. It is lying vacant. Why don't you come in and use this facility to offer healthcare, whatever. It could be a hospital or whatever it is. Does that involve money? We don't need money there. So if you look at it more closely, we want to get things done. And for that, we need resources, and always it need not necessarily be money. So I'm referring to this as social capital because a lot of these things, what you need to have to provide any of these healthcare services, it might be available in the society. It is already there. Only thing is we don't go looking for it. Probably it's a treasure chest out there, which is just waiting to be unlocked. So it's up to you to go out there and unlock this capital, unlock this treasure chest, and most of your problems might automatically be solved. So, and therein lies the role of the volunteer. like you mentioned, if you can get the volunteer, or rather the volunteer can help you on the financial aspects, they can help you with technology, they can help you with a lot of other things as well. And he or she represents the society, and therein lies the social capital which is hidden. Now, if you look at the definition of volunteer in a dictionary, probably you would end up seeing something like this. Okay, something interesting here. Someone who takes up this responsibility without being assigned, ordered, or told to do so. My question would be, why should he do that? He's just taking on a responsibility. Any takers? Why should someone get out of his bed and say that, okay, today I'm going to work on healthcare or provide health, ensure that a patient or a family gets the medical support that they need? Why should someone do that? Dedication to the work. Thank you, Dr. Rati. Contributing to society, giving back, passion. Yes, 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 and a lot more. Yes. So I just give you an example. No? Dr. K. Not Dr. K.N. Nair, 63 years old now. Sorry, he must be 65. I need to correct this slide. He joined the army quite early. He retired in 92. Now, his wife was diagnosed with stage 3 cancer, and she died in November 2004. Now, it was not like, he did not take his wife to a hospital prior to 2002. He was taking his wife to almost all the known hospitals in Trivandrum, and he had even consulted oncologists. But then, by the time it was properly diagnosed, it was at a stage where it was uncurable. Now, as someone, Maheshwari said, some incidents in their life. Yes. Now, this was an incident. Now, how would you respond to a situation like this? I have been taking my wife to all these hospitals. I have consulted all these oncologists, and they were not able to identify or have a proper diagnosis of the disease. And it was diagnosed too late. And you know what happens, when it is finally diagnosed? Obviously, he must have gone to an oncologist in 2002, and someone would have told him, okay, this is cancer at stage 3. And can you guess what would be the next thing, what the doctor would have told him? Any guesses?
About her lifespan, survival.
Okay, typically what happens is, and it happened to him, the first thing that the doctor asked him was, why didn't you bring her here earlier? You came late. Yeah, Dr. Punita. Now this is so familiar to us, right? It's so familiar. And imagine what this person would have gone through at that point. Now, can you just note down what would be his mental state? What would he be going through at this point? His feelings? Anyone? humiliated, helpless, humiliated because of what the doctor told him, I guess. Yeah. Depression, lost, guilt. Dr. Punita, you touched upon something very interesting, guilt. And that is not just self-inflicted. It was, to some extent, it was also thrust upon him, right? Why didn't you bring her here earlier? You know, we could have diagnosed it earlier. Things would have been better. Anger. Dr. Ajaya, very interesting. Angry with the doctors. Yes, all this again and more. So we can go on and on. I've been going from one place to another. Why did I?
Binod sir? Binod sir?
How would you? Sorry.
Sir, we didn't hear you in between.
Oh, okay. Sorry. Where did you lose me? What was the last thing you heard?
Like we can say, speak on and on and on.
Yes, you're right. Okay. So imagine that you are in that particular situation. Of course, I am angry. I am feeling the guilt. I am depressed. There's a loss feeling, helplessness, everything. Okay. What would be your reaction? How would you react to that situation? What would be the next course of action? Anyone? Okay, just type in. No. If you were in his position, how would you react? What would you think of doing next? Tell others to go early. Yeah. You mean go consult a doctor earlier, which he did in fact, but he didn't get the response. I mean, unfortunately, the diagnosis was not proper or it was delayed. Yeah. Anything else? Accepting the ignorance. Tell me, doctor, what can I do now to help her? More creative. Okay. Disappointment. Yeah. So this is something which probably you might have experienced at some point of life or the other, especially as a medical professional, as a doctor. There are often times when the family members come into your hospital or your room and then creating a scene, threatening you, or creating a situation which cannot be managed. Sometimes it can even go to physical abuse and things like that. I'm sure all of you have experienced it at some point of time or the other. And I believe it is just natural because of what you experience, like anger. Someone said anger. Who said anger? Yeah. Dr. Ajaya said angry with the doctors. Naturally, that is a reaction. Now, some of them may even go to a court. It could be suing the doctor or the hospital. Now, these are typical reactions from a disappointed, frustrated, angry human being who has been let down by the healthcare system. Now, Dr. Nayar's response was different. What he decided was, I don't want to spend the rest of my life running after these people, trying to find or put the blame on someone, maybe sue, take it to court, make money out of it. No, that is not what I want. I want to help the other people so that they don't go through the same experience. Sometimes it could be early diagnosis. Still, sometimes it could be a delayed diagnosis. You can't help it. But then I can be there to support these people who are going through this situation, whether it is during the diagnosis or afterwards. And now that is when a true volunteer is born. Now, Dr. Nair came to us. He wanted to do something more for this set of people. Now, he's open. He has got reasonable educational background. He has got experience working with the army, ready to do whatever it takes. Now, it's up to us to figure out how to let him into the system, accept him as part of our team, and give him an opportunity to contribute, to help us, to help the society. Now, I just wanted to give you one example. There are hundreds of Nairs. Dr. Nair is not unique. I'm sure there will be hundreds like him or thousands like him who are around us in the community as part of our society. But it's very difficult to identify these people. I agree. Now, that is going to be a challenge. Now, coming back to the role of a volunteer, now this is what some of you have been explaining earlier. I'll just go through that list. Of course, patient care, if they have the necessary training. Like, for example, if someone is a nurse or a doctor or a social worker, of course, why not? Get them more involved in patient care, direct patient care. Even otherwise, there could be some things which a person like me who doesn't have a formal degree or a certificate in medical or health care can still do, which I normally do at home. Like, for example, if it is about giving an injection for one of my family members, I might be able to do it with a little bit of training, probably. And there are so many people who even take care of catheter change at home for their family members, or those kind of things are possible. Social support, yes, and even advocacy. When I say advocacy, it's about representing these people, taking it up as a cause which needs to be attended to. That's also something which these people can do. Of course, financial side of things, fundraising is something which a volunteer would be able to do much better than us. Assistance in clerical office work. Now, these are things which you have already, many of you have mentioned, nothing new here. So, it's a broad spectrum. It's from this end to the other end. It need not necessarily be directly involved, it could be indirect also. Like fundraising is an indirect support. When you raise the funds, ultimately it benefits the patient and the family, and that's why they are also part of the team. So it's about identifying those areas where they are able to contribute based on their background, and it's about earmarking specific days or hours of a day to this activity. Because if it is not properly organized, or rather, someone walks in today morning and says, I want to do something in palliative care, you may not be able to get him to help in anything that you want him to. So there has to be some order, some commitment, both sides. I mean, we should also be committed to the volunteer, and volunteer should be committing his time or his money or whatever it is, the resource to the cause. Now it's really challenging because the problem is, like I mentioned earlier, volunteering does not involve monetary compensation. You're not paying a fee or a salary to volunteer. Now, that is where the problem comes. We cannot instruct a volunteer to do specific things. It has to be voluntary. He or she needs to feel that, this is something which I have to do. So then, is it different from a paid staff that you have in your hospital, like a nurse or a social worker? It is different. But does that mean that anyone who comes in should be just allowed to come in and start working? I believe no. We need to understand more clearly from him or her basic questions like, why is it that you want to do this? What makes that person do this particular activity? That is something very important. Apart from that, you should also try to understand what is it that he can offer. What is it that we require or the patient requires that he will be able to bring in? Like, for example, if it's a nurse or a doctor, of course, their training would be helpful. What if that person is an accountant by profession? Now, if we understand that, maybe there are ways and means in which he can help us achieve our objectives. It could be maintaining the accounts, it could be even raising funds. Now, so there should be a screening process before you let a volunteer in. And all these questions are relevant. The qualification, the enthusiasm, the commitment, and there should be a formal application and an interview process, because now an interview, it need not be very formal, it could be informal also. Like a normal chat with a person will also bring out very interesting stories, and also we'll be able to identify him or her capabilities, his commitment, all through an informal session. And last but not the least, training. Now all of us, we realize that, sometimes what we do, imagining that it is of help to a patient or family, in the process, unknowingly, we may be causing more harm than helping them. Now, why does that happen? Lack of training. I'm sure you must have gone through these sessions about communication. Sridevi, has it, is the communication session over? Raju?
Yes, it is over.
I'm sure it must have been an eye-opener for all of you. Simple things that we do, we say, we may not be conscious of the impact that it has on a patient or a family or his family. Now, that is because we have not been trained in that particular manner. The same applies to a volunteer also. Now, he may have the very best of intentions. He must be going to a patient or his house with very positive intentions and a mind to help him. But then one thing that he does wrong can actually cause a lot of harm, even kill a patient. For example, basic hand sanitization before touching a patient. Now today, everyone is so aware because of the COVID situation. The government is training us. You have it in all our social media, the importance of hand hygiene. Now that was not the situation a few months back, prior to COVID, the pre-COVID era, as I call it. Now, it's so very essential that we don't carry something, a dangerous disease from outside to a patient listening, especially with this vulnerable group. They can be, it can be dangerous, it could be deadly. Now, that is why I mentioned proper training. Before they go and try to support a patient or a family, they should be given training. Without that training, a volunteer should not be employed. And of course, proper supervision and evaluation is a must. So the challenges is to identify, what makes them do it, what they're looking for from it. Sometimes, oh sorry, audio and video getting interrupted. Is it same for everyone, or um, is everyone facing the same issue?
Is there any problem with the audio facility? Are you not able to hear us?
No, it's not for me.
Here, I don't think there is some disturbance in the background.
Just hold on, give me a minute. Is it better now? Hello?
Yes, sir, it is.
Yeah. We need to put in some effort in understanding, more about the person, or the people in front of you. Understand what makes them do it, what they're looking for in return. It could be basic stuff like what was mentioned earlier. Even the satisfaction of helping someone else is also good enough. But then we should understand what is it that they're looking for. And then obviously, we should be able to understand, or rather propose what we can offer them. If we can really understand what their needs are, we'll have more clarity on what we can offer them. Like for example, in the case of Mr. Nair, K.M. Nair, he wanted to be closer to the patient and wanted to reach out to them in their homes. He actually wanted to give 24/7, 24 hours a day for the patients and the family. Now, once we understand that, if that is what a person wants, if you are not able to offer them that, then it's going to be disappointing for him, and you may not have him for long around you. So we need to identify what is it that they're looking for, then only we'll know what is it that we can offer them. It's just a simple case of expectation versus reality mismatch, And of course, if we are able to offer them what they're looking for, then we can, make them happy and contributing, and we can count on them for a long period of time. We want to move on to something else, collaboration. It's defined as working together with a common objective. Simple definition, yet very difficult to achieve. Now, why do I need to collaborate? Can't I do whatever is required by myself? The world has changed. Now it's all about collaborations. Like for example, even let us take the example of COVID. The moment this became a pandemic, there was frantic calls reaching out to even the technology sector, even to the IT people, professionals. The governments reached out to them saying that, we have a situation at hand. We need your support. Can you help us with these things? We need ventilators. We need PPE kits. We need, technology to ensure that there is social distancing. Now, why is it that the government reached out to the masses, to the people? Why didn't they just ask the healthcare sector, the doctors and the hospitals, to make sure that you have all the stuff that you require, make sure that you treat the patients? No, that was not the approach. No, basically because when we are dealing with a situation, you need more ideas to come in, you need more expertise, so that once all these things come in, you have innovation, you have new ways of handling a situation, and you can see there's a lot of innovative ideas we can, which has come forward just because of COVID. Like for example, this contact tracing apps, and the new types of PPE kits, disposable beds, beds that could be set up in 5 minutes, things that could be transported, at a lesser cost. Now, there's been a lot of innovation around this. I'm just giving an example now. Similarly, in palliative care also, there are a lot more that could be achieved if there is proper collaboration. When I say collaboration, it is not just um, uh, from the technology experts or a specific domain. Even within the healthcare community, within the fraternity, there is a lot of scope for collaboration. Now, the scenario is changing. It's not like earlier days when there was probably one NGO. When I say NGO, it is non-government organization. CBO stands for community-based organizations. So, like Pallium India, for example, is an NGO. It's a non-government organization. It's a not-for-profit. Now, in Trivandrum, if you look at Trivandrum alone, we had just one entity, one NGO called Pallium India providing palliative care services. Today, it's not the case. Today, we have at least 5 or 10, I think close to more than 10 probably, organizations which are focused on providing palliative care. And the same is the situation with the public healthcare system. Now, each and every PHC in our locality is also into palliative care. They offer palliative care services. There is a trained nurse at least, and sometimes there is even a trained doctor. And many places they also have access to morphine and other pain relief this thing also. So a lot of things have changed. When more people are in, of course, it makes things easier, but also complicated because, you know, it's basic human nature. We can work together, but sometimes we prefer to work alone or not work with other entities, other individuals. Now, this is something which you can relate to even within your hospital. I don't know how many of you are comfortable with other doctors, other specialists from within your institution. It's very common to find that a neurologist is not able to work with an oncologist or a heart specialist, you know. So there are egos which come into the picture. If not, you know, you have the management on one end and you have the doctors at the other end. There is a fight between these two. Now, if you are focused on providing the best of care to the patient and the family, we all need to be working together. When you say we, it includes you and me, and the other doctors, and the other nurses, and the institution, the management there, everyone. We cannot leave anyone aside. So that is a kind of collaborative working that is required. Now, this is just an example. In Trivandrum, what we have tried to do is we work with a lot of other NGOs, CBOs, and even the government, where we consider each one of them as a link center. It's a link to reach out to more people, more community members. Now, individually, we may have our own limitations. We may be able to address 100 people at one time. But when we work with other institutions, like for example, the Government Medical College in Trivandrum, we provide palliative care services as an outpatient, activity. It's an OP clinic that we run every day in the Government Medical College at Trivandrum, where we take care of the palliative care needs of the patients who are referred to by the specialists within the hospital. Now, it could be a neurologist who refers the patient to our clinic. It could be a cardiologist who refers the patient, or it could be an oncologist also. Now, once they reach out to us after necessary assessment, there could be a period of time when they keep seeing the specialist in the hospital and also access, maybe pain relief or other support from our end. When I say our end, from Pallium India side. Now, situation may keep changing. At some point, you may have a situation where the patient has to be under full-time supportive care, or there is no more what you call interventional things that could be tried on the patient. So So ultimately, it is about the comfort of the patient and the family, and it might be 100% value media supporting the patient and the family. Now it depends from case to case. Now whatever it is, what I'm trying to say is we should be open to working with other entities, other individuals, organizations, depending on the need, and that is how we can reach out to more people, make sure that palliative care reaches more people in the community. There are good examples among the Chai hospitals itself. Like I've seen this happening in near Cochin, Rajagiri Hospital. Anyone from Rajagiri Hospital, by the way, in Cochin? No one? Okay. Of course, Rajagiri Hospital has a palliative care department. There is a specialist there, and they also work with the community. They also work with other community-based organizations in ensuring that palliative care delivery is happening. Even home-based care, I believe, is happening now. Anyway, so these are all good examples of collaboration. And why I specifically mentioned that is because within Chai hospitals also there are models which could be replicated, emulated. So this is another example where the community comes together to provide a helping hand to a patient in need. Now, this lady initially started off as a patient. She had a surgery. I believe there was a growth in uh, on a spine. I don't know the exact nature of this thing, but anyway, after the surgery, she couldn't move on her own. She was wheelchair bound. But then once the basic what you call pain and other problems were addressed, of course, physiotherapy and all those things, then came the next crucial question, how is she going to make a living? How is she going to survive? Now, she was very enterprising. She was willing to try out different things. And then someone came forward and taught her how to make jewelry. Now, jewelry making is something which she was also passionate about. She learned how to make jewelry. But then the next challenge was, how do I make money out of it? Making jewelry is okay, but ultimately, if I need to make a living out of it, I need to sell it. Now, how do I sell it? I'm practically wheelchair bound in my house. So someone came with the idea, okay, why don't we try online? Now, online is fine, but this person did not even know how to operate a computer. So, and of course, she didn't have a computer as well. So there was another volunteer who came forward and said, okay, I can train her on using computers. So that happened, and then there was a well-wisher of ours who came forward and said, okay, I will donate a computer. And so, and then what happened was, there was no network at home. The local service provider came forward and said, okay, we'll provide a internet connection. Now she started using this internet connection, using the computer. She went online, she started using Facebook, and she now sells her what do you call jewelry through Facebook, and she not just earns a living for herself, she is now the only earning member of her family, which includes her parents, who are also not in a very healthy situation. So she takes care of the entire family. What did she get? She got the right support from the community. It's not just Palliative India, it's about the people who were involved. And of course, there were other things that happened, like there was no road access to her home, which the locals, came together. They made a temporary road. Then the panchayat stepped in. It was converted into a proper road. So you can see the panchayat, the neighbors, an NGO like Palliative India, our volunteers, all of them came together, and it changed Geeta's life, and not just her life, her families also. Now, this is the kind of change that you can, the impact that you can expect if the community, the society takes it up and comes forward offering their help. But at the same time, we have to also understand that it's not like, collaboration needs certain things also to be there. Like I was mentioning earlier, one thing that cannot work is our egos. At the same time, we have to be realistic. We can't expect everyone to be altruistic, only considering the social cost. We are all individuals. We have our own limitations. We have our own personal our own weaknesses. It could be our ego. It could be whatever. I mean, the negatives in us. So just because you are collaborating, it does not mean that all your self-interest will disappear or should disappear. Yes, agreed that we are coming together for a common cause, but then we have our own personal interests as well. And of course, these are exceptions. Someone like Mother Teresa could actually do wonders. She went outside her country. She went to a foreign country. Supported the weakest of the weak, not just financially, and whenever there was some help that they needed, she was out there with the community. Now, these kind of people are very, very rare. It could be 1 in a million. And we have not heard of other Mother Teresas. Of course, we need hundreds of them, but sadly, we don't have. No, and we can't turn everyone into a Mother Teresa either. So within our limitations, what is it that we can, practically achieve working with other individuals who are normal human beings? That is a challenge. And of course, you need leaders to lead this movement. Now, it's okay, 10 people coming together is fine. You may be able to solve the problem for a patient like Geeta. But then we have to also remember that there needs to be some kind of a leadership in place so that it is more organized rather than 10 people doing 10 different things, and ultimately if it doesn't help the patient or the family, it is meaningless. So we need to have some kind of a leadership in place where people come together. It's more organized. There is more focus on what the action, what is to be done and what is being done. Now, that is the real collaboration. And now, where does it start? Now, this is where most of us get stuck. I understand, okay, I cannot offer all the services as we dream of in palliative care, the psychosocial, spiritual, and all the support that is required. I want my patients to have it. You and I want our patients to have it. But then there are limitations. Now, I know that collaboration should work. It should be there to provide these services to the patient. But then where does it begin? Who will take up the effort to initiate that collaboration? Now, I believe it starts with me. I am the person who can initiate that, who can make a difference. And it starts with myself some tough questions. It's a process of inquiry, going deeper, really asking those questions, why do I want to do this? What is it that it's, sorry, yeah, okay. So what is it, sorry. What is it that I want to offer to these patients and the families? Now, how do I go about doing it? What is in it for me? All these kinds of questions, that is a process of inquiry. Now, that leads to another stage called the innovation. Like for example, once we identify the massive challenge in front of us as far as COVID-19 is concerned, that is when we realize the current healthcare system, the current way of handling things, the current, even someone was telling the other day, we thought epidemiology was a science. And today we realize that it is probably not there yet as a science. The ideas keep changing, new concepts come in every day, and along with it, you need to keep on improvising. You need to keep on devising new ways of combating this menace. Now, there is a lot of innovation that has happened over the last few months in front of us in terms of the COVID-19. Now, that is a kind of innovation that is required even in palliative care. We have huge challenges in front of us. Now, if we need to meet those challenges and achieve results, we need more innovation. And once the innovation happens, it inspires a lot more people. Like for example, palliative care was not something which was unknown to the rest of the world when it started here in 92. 1992, when it started off in Kerala, in Calicut Medical College. By the time most of the Western world, especially UK and the developed countries, they already had palliative care as part of their healthcare offering. Now, what was different with Kerala? Why is it that people talk about the Kerala model of palliative care? Now, the innovation that happened here was something which the world today recognizes as something which made it possible for a low and middle income country to actually provide palliative care. Now, until that point, it was mostly the developed world, or where the infrastructure was already available. They were the ones who were offering palliative care. There was no model for the developing world or the third world countries, as they call it. Now here we had a new model, and what was the model? In Kerala, the community got involved, and probably that was the first time in the whole world that the community actually got involved in healthcare. And that was the innovation which made it possible for palliative care to grow in Kerala. Now, having said that, I'm not saying that the same thing can be replicated in every other part of the country or the world. Each and every location has its own uniqueness, it has got its own challenges, but then I'm sure that there is possibility of innovation where you can overcome those challenges. And once that happens, it inspires people. Like what happened in Kerala has actually inspired people or organizations across the country, across the world, to try and do more in palliative care. They started believing in themselves. They started realizing that okay, it is not just the blaming the healthcare system or the government. It's not the governments who should actually step in and do things. It is us. We are also part of it, and we can actually do something. And it creates a impact, and the impact has got a ripple effect. It goes from the individual to the society, the community. It goes on and on. It's the ripple effect. It grows, and this is when the whole idea of Pallium India. If you look at our vision, we talk about making palliative care available to whoever requires it in every part of the country. So each and every part of the country, if this has to happen, we need this ripple effect. And what does it take? What is the key to collaborative working? I think I'll just stop here and I wait for some answers. How can it happen? If collaboration has to happen, if it has to be successful, what is the key? Any ideas? So the clue is, it's about understanding each other's, when I say partners, it's partners in this particular domain. You know, it could be other hospitals, it could be the management, like I said earlier, you know, the contacts, yeah. So the key to collaborative working is understanding each other and identifying what the common goal is. Again, how do we achieve that? How do we identify, you know, what the common goal is? How do we understand what the other partner wants? Yes, the strengths and weaknesses of the collaboration, the organization, agreed. But how do I know? There's only one way out, and that is what palliative care teaches you. And what is that? It's active listening again. If you listen close enough, the other party, the organization or the individual, you know, they will let you know what is it that they want out of it. Like for example, we reach out to medical college. Now, it's not easy for a medical college to work with palliative, an NGO. Now, it happens over a period of time. It's a lot of negotiation, lot of discussions, and then we try to understand each other's requirements and we get into a formal working relationship. Now, this has to keep on happening. It's not like, you know, you achieve one and it stops there. No, it is a continuous process. And I'll just briefly touch upon advocacy and fundraising. Now, when I say advocacy and fundraising, I put it both together because it's complementary. Now, what you do in advocacy actually helps fundraising, and when you do fundraising, automatically it helps advocacy. Now, what is the meaning of advocacy? Simply put, it is playing the role of an advocate, just being an advocate for a patient or their family. Now, what does an advocate do for us if it is a legal suit in a court? That advocate will fight for our rights, for what we want out of the system. And the same thing applies here. Now here, we, you and I, need to play the role of that advocate, where we draw the community's attention to this issue, to the gap that is there in the healthcare system, and make sure that the community is made aware and it starts taking action. Now, when I say it starts taking action, it includes the policymakers, primarily the MLAs or the MPs, the government. I'm also including all the what you call the bureaucracy, the IAS officers, all those people, because that is very, very important. And not just the government. We need the community to, I mean, Aam Aadmi, as you call it, you know, the lay person also to recognize this, the understanding needs. We also want the private hospitals to step in. We also represent the patients in those hospitals. They are not aliens. Now, so how does it help? It helps change attitudes and behaviors. Like for example, going back to our situation with Dr. K. N. Nair, not Dr. K. N. Nair, sorry, Mr. K. N. Nair. Now, if the oncologist had known about palliative care or had some basic background or basic communication training, he would not have asked that question to K. N. Nair, you know, why didn't you bring her here earlier? Now we realize that was a stupid question because now we have undergone this training and we know what we should say and we should not say. Now this change in behavior, this change in attitude, that can only happen with advocacy, the awareness, basically creating the awareness and things like that, plus change in policy. Like for example, today we have the government, what you call palliative care policy in Kerala, which makes sure that the entire healthcare system, the government system, has palliative care offered at even the public health, what you call the primary health center. Now, that can happen only with advocacy work at the appropriate level. It changes policies, it changes laws like the NDPS amendment, which I'm sure you must have had a separate session on that, including morphine, how it is controlled and what are the licenses and other things that needs to be there to dispense those things. So I'm not touching upon those things, but these are changes which have happened over a period of 20 years, and it's not easy. It doesn't happen overnight, and it's also include. I mean, we also need to consider the medical professionals who are being trained. They need to have the part of as part of their curriculum, pain and palliative care training. Those things happen again at a different level. We cannot just go into a medical college and say, come on, we want you to start providing training in palliative care tomorrow onwards. It simply cannot happen that way. It has to go through the MCI or whoever it is. It has to be a government policy. So these things require a larger machinery to move. And of course, all these things also help give our work a broader impact. And it helps in fundraising. Now, how does it help? Very simple. I'll give you an example. If I go to, just give me a moment. Sorry, just a moment. I need to connect my charger.
I think his laptop might have been
Sorry.
switched off.
Yeah.
Okay.
So yeah, I'm using the phone now. So Raju, can you just share the last two slides? I think it is an ultimate one. Can you hear me?
Yes, I can hear you.
Yeah. Okay, so next slide, please.
So can you
You are
unmute?
muted.
Yeah. So I'll just give you an example how advocacy can actually help with fundraising. Now, when if I have 10 rupees with me and you come to me and ask for um, money to support your palliative care venture. Now, if I am not aware of palliative care, what it can do, how it can help someone, my immediate reaction would be, let me think about it. Now, if you come and ask me 10 rupees for a child, his education support, I may be willing to offer that. Now, what is the difference? Because I know for a fact that, okay, with this 10 rupees, it's going to be used for a child's education, which will make him capable of earning money later on at some point, and that can help his family, and so on and so forth. Now, the very fact that I realize the importance of education for a kid makes me provide that 10 rupees to you. If I'm not aware of that, I will not give you the money. Now, same is the case here. And going on from there, we have to understand that people don't give money to organizations. People would like to give money to people. Like, for example, when I am willing to give that 10 rupees to you for a child's education, I am actually giving the money not to you, but actually for the child or the family. I'm supporting them, not you. So whoever is in between, I believe that is just a vehicle for someone to reach out to the real needy person. So we have to understand that, because then only we will be able to approach a donor, someone who is willing to donate money for this cause. We should be able to tell those stories about the people in need, and they have to actually be convinced so that they will start supporting this. So it's not about the money, it's about the need out there, and we should realize that money is just the means to an end. Sometimes it may be just approaching someone for medicines. He may be willing to offer those medicines for free. That will also help us. It need not necessarily be about giving us the money. It may be about providing us with the medicines. And it's not similar to selling, where like, this is something we are often used to. You have a salesman in front of your door trying to convince us about something very exciting thing, which can do a lot of wonders for you, and ultimately you end up paying that money for something which you don't. Oh, thank you, Dr. Prema. um, you don't even need, and you end up paying the money for something you don't need. So it's not selling. Actually, if we are doing fundraising, we have to understand the person who is donating the money, who is a donor, and us as a fundraiser, we are both on the same side. We are trying to find a solution for a common problem that we see of the patient and the family. So this has to appeal to the emotions, their minds, their hearts, and they will start contributing. So in fundraising, the fundamental thing is not ask people to donate or pay the money, but it's about inspiring them to give. So yeah, next slide, I think. Next one. Hello, Raju.
Yes, sir, I have changed the slide.
Okay. So what does it involve? So being honest with your donors, It's about storytelling. It's exploring, providing the telling the stories of the patients and the family. That is what will relate to them. They can understand the pain and the suffering. And of course, be as open as possible. Share your challenges, the problems that you face, as well as your successes. And again, it's good. The most important thing is to be a good listener, because the donor, the person who is giving you the money, will actually come out and tell you what he wants to give. If we keep on asking him, give me 25 rupees, he will not give you. But if you are able to share the story, the need, they may come out and say, okay, it's not 25, it is 2,500 that the person wants to give. So it's about, again, being a good listener, understanding his side of things, and that is something which will help you raise funds for this cause. Next, I think we are done. Yeah, there are other opportunities. This is something which you can explore depending on your capabilities. Like, for example, there are various ways of raising funds. One thing which we quite often see is organizing an event. It could be a rock show, it could be a dance show where a famous personality might be willing to do the program. We raise funds out of it, and that money goes to the palliative care needs, or whatever. The cost that you want to work for. There are government grants, there are grants being offered by institutions which are also accessible. Only thing is, we need those skills, like budgeting skills, project writing skills, to access those things. So similar thing is campaigns, like, for example, the social media campaigns that you keep seeing. It is now, things have changed, technology has taken over. If you have the skill set, I think social media campaigns are really doing wonders nowadays. We can raise enough and more of money, or anything that you want, by properly having a properly designed campaign and organizing one to perfection. So that's it, I guess, Raju. I don't think we have much time for questions. Sorry, we have lost some time in between also.
I think maybe we can take some one or two questions, and rest of the questions, if they have any, we can always get them back through email.
Sure. Yes. Yeah, that's a good
We can take one or
suggestion.
two questions today, because we have 2 minutes more. Any questions to Binod? Either you can unmute, or you can type it in the chat session. Raju, is there anyone raising hands, or?
No, ma'am.
Systems, yeah.
Dr. Mercy, do you have a question? Ma'am, can you unmute from your end and speak? Left end, you can see a microphone option. Can you click on it?
No, we can't hear Dr. Mercy.
Ma'am, can you see a left and bottom? There is a microphone option. Just click on it. Left bottom end. A microphone.
Okay.
Mic option.
Question from Dr. Punita, Bangalore, to everyone is, will clinic-based palliative care be possible integrating with higher centers and community? I didn't understand the first part of that is with higher centers. Um,
I think Dr. Punita is
again,
working in a tertiary care center. So is it collaborating with the tertiary care center and the community, and you are sitting in a separate clinic for palliative care? Is that what you mean, Dr. Punita? Collaborating both the tertiary care hospital and the community through you.
um,
Yes, very feeble
sorry.
voice I heard, so it is yes.
So I understand you are in an individual clinic, and you would like to offer the service collaborating with the um, tertiary care center. It's a hospital in your locality, probably. Is that right? The question is around that.
Yes, yes, that's what she used, and involving both community, like including community and the tertiary care hospital, both.
My answer would be yes. Definitely, we have experimented with it, and it has worked for us. Um, so again, it depends on the kind of relationship that you're able to establish with this tertiary care center. Once they realize there is value add for this offering, this service offering for their patients. Now, this is very critical. Now, if we approach a big hospital saying that, okay, my patients need palliative care and I want to use your facility to provide my patients the care, it will not work. Now, if it is the other way around, if there is a patient who is their patient, now we have this concept of your patient and my patient, which is stupid, I agree. But for the sake of identifying, okay, this tertiary care center has a patient. Like for example, this Medical College Hospital in Trivandrum, where you have neuro patients, you have patients consulting the cardiologist. Now, for them, if they need access to palliative care, and if you go and tell them, I can provide this additional care, what your patient needs, that would work. Because ultimately, for a hospital, it is about their patients, whether we like it or not. It is their infrastructure, their money, all those things. It is very, they would really like to think of from that perspective. So it's about understanding their perspective, their interests, and then tuning your requirements accordingly. So it is possible. It's the approach that needs to be right. Yeah.
Thank you, Binod. Uh, I think we have reached the time is 4:34. We overshoot 4 minutes. If there are any other questions, you can always put it in the WhatsApp group, or you can send us an email so that we can give it to Binod and get your answers back. Thank you so much, everyone, for participating, and thank